What's up, everybody? Welcome to the Better You Project, optimizing health, hormones, and aesthetics. And today I have one of my very own from the YDH Training Academy. I have Simona DeLucia. I don't know if that was even right. She is a nurse practitioner out of Florida, which Florida is kind of a unique state. And I've actually tortured her and picked her brain a little bit as I've gotten my Florida license. She has done an amazing job. So she's an injector. She has a very well-known aesthetics space in Florida, but she has done a great job over the past, I would say, 3 to 5 years in transitioning into functional aesthetics. And I think that this is a really hot topic right now because there are a lot of aesthetic practices who are bringing in, I'm just air quoting if you can't see me if you're driving in the car, wellness. And wellness can look like a lot of different things. Simona and we run in the same conference network, which it's always good to see the Academy members. But she has really jumped into peptide therapy and longevity medicine and has done the longevity certification. So it's not like she just slapped wellness on the back of aesthetics. She's actually talking the talk and walking the walk. For that reason, that's why I really wanted her to come on this episode, because I know that there are a lot of aesthetic practices who follow my Instagram or who are in my academy. And I feel like she's done a really great job of paving the way for many of them. So are you ready?
Yes.
Awesome. So Simona, give us a little bit about your background as a nurse practitioner, and then what brought you into aesthetics, and then why transition into functional.
Well, thank you, Lexi, for having me. My name is Simona. I am a family nurse practitioner. I have been nurse practitioner for, I think 8 or 9 years now. And honestly, this journey wasn't just a business decision. It was deeply personal. So I was a successful injector. I am a successful injector. And from the outside, everything looked great. But behind the scenes, I was struggling with my own health. I was diagnosed with Hashimoto years ago, and I felt tired. I felt inflamed. I was gaining weight, and I was emotionally drained. And when I went to my doctor, he was telling me my labs are fine, you're fine. I was on Synthroid. So I felt like I was falling apart. And that disconnect between what I was being told and what I knew deep down lit a fire in me. And I was like, I have to look for answers. I have to start healing myself. I had all these, I started seeing my patients, all these beautiful women, and they were basically telling me, they were coming for Botox and fillers, and they were telling me I am not sleeping, I am anxious. And I was, when I started healing myself, I was like, how many women out there are like me? And I realized that I was called to do more, that I wanted to offer something deeper. So I started studying functional medicine, peptides, hormone replacement therapy, and it felt like the light just turned back on, and I just couldn't go back to be, back to the surface level work after that.
Mm-hmm. Mm-hmm. Yeah, no, absolutely. I know, I want to say 2-3 years ago, you were working in urgent care, and you and I had a discussion, and you're like, how do I know when to do this full time? And my response is, you just got to do it. You just got to commit to do it. And my husband always says, and you've met my husband, and I've met your husband, and my husband says, I don't know if it's just irrational confidence or just stupidity, but she's just like, what's the worst that could happen, kind of thing. And I don't know. I'm like, everything could go right too. I don't want to think about what's the worst that can happen. Now, again, I think everyone needs a yin to their yang to ground them a little bit, but that was the conversation we had. And so walk me through, what did that look like for you?
To make the decision.
Yeah.
That was probably the hardest decision I have ever made, in my life. And deep down, what you should do. But I think you want somebody to tell you yeah, it will be okay. Mm-hmm. My husband, he said, I am not going to tell you what to do because, if it goes wrong, then you will blame me. Yeah. So I was when I listened to your podcast, from the beginning, like every episode, and you were very similar to me. So we kind of went to the same route, and I was like, well, I have to ask Lexi, like, what should I do? And you didn't tell me, but you kind of told me,
Mhm.
and I just went and I did it, and I'm happy I did it.
Yeah. Yeah. It's amazing how many, like the comfort of working for a big network, right? A steady paycheck, the comfort of having, like working in urgent care. That's where I worked. That's where Alan worked. Is, that there's always going to be patients, right? And so I think, I think it's always going to be scary, but it's kind of like one of those things, like I don't have any choice but to succeed. Like failing is not an option. Like we're going to make
Yep.
it work. If we have to pivot sideways and pivot a weird way, we're going to make it work. And so I think, again, for you, you have really just done a great job with learning everything. Like every course I feel like I put on or podcast interview, you're there. You're like front and center. I know Alan always says like, oh, is Simona going to be there? Like, cause he knows who you are, just like everyone knows who Alan is, And so I think you've truly have immersed yourself into it, which is what I would say. Best advice is if you're going to do it, freaking do it. Like don't half-ass it. Don't dip your toe in it. Like jump in and like let's get it done, kind of thing. So you're an injector. You're taking these functional medicine courses. You've been through my academy. You've been to multiple different conferences. So tell me, how is it having that conversation with your aesthetic patients into like, we need to dig a little deeper. Talk us through what that looks like.
So, my patients are my biggest supporters. I basically, when I started this whole thing, some of them were surprised, some of them were skeptical. So I have to do a lot of education. And when they come for Botox, I was going, my Botox appointment, I made it for 1 hour. Not 50. I can do it in 15 minutes, but I was like, I will do it for 1 hour. And I started asking about their sleep, their cycles, their gut. But when I started asking these questions, something amazing happened. Those questions started opening a door that they didn't even know it was there. So women start telling me things they probably never shared with their providers. That like I feel like people feel when you do somebody's face, they have to trust you because it's their face. That's the first thing you see. So I already had developed their trust and they felt safe. So over time, they became deeply invested in their own healing. Now many people come back, they don't even ask about injectables. They want to know what's my hormones, what supplements will do next, for my skin. And I feel like, we're supporting the skin from the inside and inside out. So it's been the most beautiful journey to watch, the transition, to witness.
Yeah, absolutely. What do you feel like percentage wise now from a business? Like what percentage of your patients are aesthetic only versus what of your percentage of patients are maybe only functional? And then what would you say is the blend percentage wise?
Right now, I'm still 50-50 right now because I do like the aesthetics.
Yeah.
I feel like that's the art, that's my fun. But now I have pellets and Botox because it's every 4 months. So that the patients who wear my aesthetics, they converted to the functional, and I just I just keep going.
Yeah. Yeah. How did your patients respond? Like your aesthetic patients when they're like, oh gosh, Simona, what are you doing now? Or, how was that response from the patient? And I say that because I was functional, then did aesthetic. So I'm like opposite of most people. And it was super easy. It was like the easiest thing ever. Just as you said, people have to trust you with their face. Like I knew the most intimate details about their vagina, about their bowel movements, about their mental health. So for me, jumping into aesthetics was actually a really smooth transition. So how tell me about your patient response.
My patients were I think my patients are the reason I am doing what I'm doing. I actually had a patient who came for Botox and, she told me, Like after I inject, they tell me I have some kind of energy. I still don't know what they mean. They said there is some energy around me. And she said, I have a full-time job, but I am also a psychic. So I was like, okay, um, I am not like that totally believe everything, but she started telling me things that I was like, wow, this, what's going on. And she told me that was last year. She said, next year, there is a shift coming for you. And you might not like what I'm telling you right now, but it will happen. And she said, you will drop the aesthetics and you will be healing people on different level. And I'm like, what is woman talking about? I love doing
Yeah.
lips, all this stuff. But now I'm like sitting back and I'm watching everything's happening in front of my eyes. And I'm like, wow, like, I am patient. My calendar right now looks this week it's functional at 25% aesthetics. Like it's crazy, but it's summer, and usually summer it's slow for aesthetics, so it's a balance.
Yes, no, absolutely. And we always say the J months, January, June, and July is always going to be really, really slow. But I tell you what's not slow. On the functional side, it's not slow. They need their hormones. And the only thing I would say is with people who get pellets is you can't get in the water, for a couple days kind of thing. So I've actually had some people transition to Kaisertrex in the summer, and then their plan is to go back to pellets, kind of in the fall. So there's that.
Interesting.
Yeah. So tell me, what is your like training? So what training did you do to become an injector, and then like training wise, what courses did you take for your functional side?
So for the injectors, I did. It was a 2-day course, which I do not recommend. I feel like I really didn't learn. You learn the basic, but it has to be more in depth. And I think it was the Aesthetic Skin Institute in Fort Lauderdale. It was Saturday, Sunday. I just went and did it. But I feel like practice, My husband is my guinea pig. He has everything done. Whatever comes, I do on him. So I learn basically keep doing it. And you have to have eye for it. Like if you don't have the eye for this, like sometimes my colleagues was me to train them, they ask how much you do. There is no protocol. Like you have to know the anatomy, you have to know what you're doing. For the functional medicine, I did the IFM courses. The Institute of Functional Medicine, I think, is the first course introducing to medical practice, which really helped me. And YDH Academy, I am like there, I buy everything. And me and you are on the same mindset. Like the way you think, I think. So how your courses are broken down, that's the way I like it. It's very structured. Then SSRP, I did the peptides with them, which was great. Sometimes I'm lost with Dr. Sid because he goes way deep down. And BioT, I did the BioT hormone replacement therapy certifications, which that was great.
Mm-hmm. Yeah, absolutely. So when you started, your Instagram handle was like the VIP Injector. And then I kind of noticed a shift, and you and I had a really long discussion at like the end of one of our webinars. I said, everyone can get off except Simona, like class dismissed except you. And so, you hung on, and I was like, well, tell me what's going on. Like, what are you doing? And so talk about why the rebrand.
So, I felt that I needed to do something more. There was something missing.
Mm-hmm.
I love the injections, but I knew that that's not the whole me. And it was really like when the VIP injector, like when I went to the longevity conferences or, when like I said the VIP injector, I did not want it to be known as the injector anymore because it wasn't who I was becoming, So I was like, I have to change this. I have to redo the whole business. I just seriously woke up and I was like, I'm doing this. And it's still like people cannot find me now because I changed everything, even though, I put it out there. But yeah, it was, I should have done it a long time ago.
Yeah. So It's more than just changing your Instagram handle. You went and you did like your website changed, right? You added more services on there. Now, did you hire a company to do that, or did you kind of do it yourself? Like, did you have someone helping you, or was it just kind of like you and your husband trying to like do it?
So the girl who did my website, the VIP Injector, I already had a functional medicine on it, but it was like in the back corner hidden. And when I told her what I was planning to do, she already knows me. So she's like, I am going to just flip it. And I probably drove her crazy because I'm like OCD type A personality. So I told her what I wanted to do. Like, I don't want it to be boring. I wanted to deliver the message. Like, when somebody looks at the website, they know who I am. And I think she delivered that because one of my patients said, somebody found me somewhere and they went to my website and they said, you do everything that I am looking for. And it was right there.
Yeah.
So,
Yeah, that's good.
yeah.
That's good. You don't realize how much thought and strategy goes into a website until you're trying to really maximize on the real estate you have on a website. Now, have you done any marketing through like SEOs, which is the search engine optimization? Have you done you do a great Instagram, you and I talked about that. What like additional strategies did you employ to like try to really get this rebrand like relaunched?
I really didn't do anything, to be honest. Like I'm the only person right now. So my son has business marketing degree. So he's my go-to. If I don't know something, he helps me. But I am word of mouth. Like I don't even know how these people finding me, honestly.
Yeah.
But I think that's the best way to grow. The only marketing I use, it's my Instagram. Um, and that's all I do right now.
Yeah. Yeah. And, I think that's so valuable. And I'm so glad that you said that. So Min and I did not hire a marketing company at all until last year. And so we were in business, 5-6 years before we even touched marketing. And some people are like, well, tell us about your marketing strategy. And he's like, my wife has Instagram and an iPhone. Like, that's literally same with you, right? That's it. Organic growth is the best growth. And not only that, when your patients who already see you tell their friends about you, those are what we call warm leads in the marketing world, but they're the best because they come in like, Simona, I know I need pellets. I probably need some peptides. Let's do a gut. Like, you're like, great. Yeah, I'm here for it. So that is word of mouth is really the best. Now, what has happened, when I started in this industry, just functional, I've been a nurse practitioner 14 years, but 7 years ago, I started in functional, is there was like nobody doing this. Like nobody was on Instagram. Nobody was really doing this. And now it's like one on like Starbucks, right? Like one on every corner kind of thing, which can be good for the industry in that it brings about awareness and more people have opportunities to seek care, but it also can be bad for a couple of reasons, but I'm not going to get into that. But I think the most important thing is that find a strategy and really consistency. Like you got to be consistent, right? And you are super consistent with posting stories, and you do a nice little blend of functional information, peptide therapy, menopause. Oh, here's a before and after. Like you do a really good blend. And I think that's really hard for people who want to flex and be able to do aesthetics and wellness both is like, what does the strategy need to look like? And it's consistency and variety. I think is the key piece there. And not only that, like you said, interacting with your community, right? So like my goal is to try to create this like nice little community. My goal is not to get to 1 million followers. That's not really my goal, but my goal is to create awareness. And then when patients come in, they're like, oh my God, Lexi, I got that walking pad that you got. So much so people ask me like, what lip color do you wear? What facial, scrubber wipe thing do you talk about? I had my intern make me a little Amazon storefront because I'm like tired of telling people like, oh, here, let me send it to you. I'm like, here's the walking pad I use, knock yourself out kind of thing. So you're absolutely right. It's very much organic is the best way.
Yeah. And, about the Instagram, like I ask people like, I get approached, like, do you want me to manage your Instagram? I just feel like I wanted to deliver a certain message and I don't feel like, I'm invested in it. I research everything. I know what I want to put out there. I don't feel like nobody else will deliver it as you, you know?
I completely agree, and I've tried to outsource mine maybe twice, and it was like I ended up having to redo it anyway because I want it through the eyes of me. I want it through the eyes of the practitioner on like what I'm seeing and how I explain this to patients. And you're right, you're absolutely right. It comes better from the creator, kind
Yeah,
of thing. So
like, yeah. So when I'm reading something or studying or doing, I'm like, hey, people probably don't know this. And that's where the post comes, like sometimes I was like, wow, I didn't know that. So if I don't know it,
oh
a lot of
sure,
people don't know it. So that's how
yeah.
I do it.
How did you decide from like a functional medicine wellness? Like, where did you start? So I know that you started with like adding in some hormones, but then like, how do you decide when to then add in the next knowledge or the next service or the next thing? Because I think one of the things, Simona, that I see, and I know you read it too in our academy, is that they come in new and they're so overwhelmed by everything, and they're like, I don't even know where to freaking start. And I always say, listen, start at the core: gut, hormones, adrenals, like thyroid, hormone, gut. Start there. Get really good at that. Then you can do the fancy ozone, the fancy peptides, and all these things. But start there.
Yeah,
How did you
definitely.
how did you decide like where you started and then what you added next?
So, well, I started basically what changed my own life. I started with hormone optimization, gut
Mm-hmm.
healing, and peptides. From there, I advanced to lab testing, nutritional support, nervous system regulation, lifestyle coaching. And it wasn't not about creating the list, like the checklist. It was about I wanted to create a healing experience. Like I wanted DeLucia Vitality to be a place where women could finally feel here, like that we listen and where we can connect the emotional, physical, and energetic parts of their journey. So my program wasn't about like perfection, but it's more about empowerment. Like, uh, like I want to build a community, just like, I want to get involved. Like I'm doing a retreat next month that, the women comes and I want to educate and show them what's out there because we don't put it out as much. Now this year it's all over the place. Everybody's talking about everything, but last year wasn't like it's this year.
Yeah. Yeah, that's amazing. What would you say were maybe some of the challenges that you had going from an injector into the functional space? Like what was the biggest one or two challenges?
um Challenges, how to basically the functional medicine, that was the challenge. I didn't know where to start. Like do I start with the well, everything starts with the gut, so I did start it with the gut. But the challenge was, learning about the peptides because they are difficult. So I would say start with one peptide, master that peptide, and then move to the next peptide. I started with BPC 157, which is my favorite one. And I started because of my husband, really. He had a stroke at age 49. And they put him on all the protocol. He was healthy and he refused to take all the medications and everything. So I was like, well, BPC 157, regenerates tissues in your brain. So let's try it. That time we could inject it. So, and it cured him 100%. So I started with peptides and gut and just pick one thing, master it, move to the next.
Yeah, that's perfect. One of the biggest challenges, and we talked a little bit about this yesterday in our mentor call. I'm not sure if you watched the playback yet, but sourcing, right? Sourcing and where to find peptides and research peptides and all those types of things. I would say back in the day, Simona, when we started doing this, it was much easier, right? And now that the FDA and pharma and everyone's got regulations on peptides, it's almost a scarier place now because now you have new providers who don't know the difference, who are resorting to research grade peptides. How do you feel like, how do you stay up to date on the peptide changes, the change in landscape and all those things?
So, I work with very few pharmacies that I trust, and I go by what, SSRP recommends too. and no bioage recommends, because I feel like they already did their research kind of things, and they know. I get approached every day by now, like, the labs are approaching me. I I want to, it's my license. I work very hard for this license. So I am going to just stick with the people that
Mhm.
are, follow the rules basically.
Yeah.
And
Yeah.
that's what I am. I am not, I'm staying away from research peptides. I get
Yeah.
asked about it all the time, but it's not something that I want to do, or, that's just my opinion.
Yeah, no, it's great. And again, I'm not sure if you listened to the call yesterday, but Min
I
actually
did,
shared.
yeah.
Okay, so he said, unfortunately, the liability comes solely on the practitioner. Like the research facilities are like, sorry, if you're not seeing me, I'm like wiping my hands clean. Like, sorry, this is what you recommended, and I refuse to go before the board to try to explain why I recommended this research grade substance when I didn't know anything about their testing, their endotoxins, their sterility, their manufacturing practices. It's just too risky. It's just too risky. And then not
It's
only
not
that,
worth it.
no, it's totally not worth it. You've worked so hard for your license, and setting up a business that it's totally not worth it. So I think not only that, I think when the category 2 happened, the situation with category 2 happened in October of 2023. I remember because I was literally going to a conference with Leonard, and Leonard's like, "My life is over," and I'm like, "Calm down, Leonard. You're going to be fine." I know. What I will say though is it gave people like us a opportunity to be innovative and to use and repurpose things that are completely safe and completely legal and have research behind it for different ways, right? So methylene blue was something that I feel like really kind of came out of it. The use of NAD, the use of oxytocin, some of our repurposed drugs, pentosan polysulfate, telmisartan. I mean, there's so many things that I feel like came out of the recategorization of our peptides that allowed those of us who understand cellular medicine to really like, okay, I'm just going to pivot. It's not a big deal.
But
So
the thing is, the people who understand cellular medicine, there are a lot of unqualified providers who are doing this right now, especially in Florida. Like, I have seen it all. And I feel like it's more than underdeveloped. There are too many people doing injections and without real clinical knowledge. And now I see the med spas, who are just adding aesthetics and longevity. And, I feel like patients are paying the price. Like, if, the providers have no clinical knowledge, they don't have any certifications, they will prescribe like peptides. I had a patient who, like, they stack up the peptides, and then I do the blood work and it's a mess. Liver's a mess. They don't understand the pathways that everything goes to. So I just feel that, like, there are even providers who have no medical license doing this. So I think we need to raise the bar, and we need, because everybody is doing, they think if they do GLP-1, then, that's it.
Yeah, no, it is. It is. So I would say, this gives us a good segue. If a patient is looking for a provider and they want to do the type of medicine, they're interested in becoming a patient of the type of medicine that you and I practice, what would you say are like 3 red flags and 3 things you should look for?
So number one, if you're looking at a provider, go and verify their license. They have a medical license, they're licensed in the state. They basically are okay to do what they're supposed to do. You want a provider that will ask questions. Like, you want a provider who asks you, how's your sleep?
Mm-hmm.
How's your menstrual cycle? How's your gut? If they don't ask these questions, then you don't want to go there. You also
Right.
want a provider who will, who spends an hour with you. I like patients who come prepared. Like, they show me, I have all this research that can I show you? Or I found this on Google. Like, you want a provider who's open-minded. Red flags. Don't go to somebody's backyard. There was just somebody got arrested in Florida doing this kind of work in the backyard in their little, house. So that's a red flag number one. Don't go there. Um, yeah, it's just go to somebody who and research. We are open book. And you Google our name and it's out there. We have our NPS number. There is reviews. Make sure the reviews are real, because look under Instagram, look at the comments. Like, do your research before you go anywhere. If it's too cheap, it's probably not good.
No, I completely agree. I would say it's I get DMs or portal messages from patients like, I have a relative in such and such state. Like, do you have a recommendation? And what's hard is, like, let's say the patient does pellets with us, right? But I have them on like 3 or 4 peptides. They've done IV ozone. They've done a gut test. And they'll say like, well, they're interested in like all the stuff I do. I'm like, just so you know, this is not normal. This is not what we do, is not the norm. Some people are like, oh, they're just a pellet practice, but they don't do anything else. Or they're just like some practices are kind of known for like, oh, they just treat Lyme's disease and they're not known for anything else. So it's hard to really give a good referral. So just as you said, looking at their licensing, A4M has a database where people have been certified, which is the Academy of Anti-Aging. IFM has a big database for the Institute for Functional Medicine. So those are your certified functional medicine providers. I don't know if Seeds does that. I'm not sure.
I don't think we are on. I know IFM. You can go and search the providers, and we are there. We are listed.
Yes. There's also like BioT has like a search or provider database. But again, if you're looking for people like Simona and I who do gut testing and who do peptides and things like that, just because they offer pellets does not mean that they're offering the layers of peptides and the layers of holistic in-depth looking that we're digging into. So just kind of keeping that in mind. And just as you said, I think the Google reviews are absolutely huge. The more volume, the better, in that you can get, if they have a 5.0 but only 4 Google reviews versus someone who has 200 and they're a 4.8, I'm going to go with the 4.8 because the sample size is larger, right? And that's what, we learn in research, is a good sample size. Yeah. And then red flags, just as she said, like, are they in it for like a quick buck? What's the follow-up? Are they not spending time with you? Are they really hearing you and explaining in an in-depth analysis? Are they doing body composition testing? Like, what does that look like? Are they checking your labs? What's the follow-up? So it's hard. It's hard because everybody can look like an expert. And then you start digging into the details and you're like, oh, that's not at all what I thought was going to happen. So
yeah, and that's what it is. Now you have like injectors, which was me, and I became an integrative provider. So how do you tell the difference? So like I said, ask real questions. Look for somebody who sees you as a whole person, not just the face. And if they ask about your gut, your mood, your periods, your sleep, that's integrative care. That's where you basically want to go.
Yeah, absolutely. Well, this was such a good episode. I think this would be really popular amongst practitioners, but I think towards the end, if you're a patient or maybe you don't see us, but you're interested in this type of medicine and where to find a provider, I would use those tips and tricks to try to find a good provider, as well as, what maybe is a red flag kind of thing. So Simona, where can people find you?
So they can find me on my Instagram, DeLucia Vitality. My website, DeLuciaVitality.com. I am located in Davie, Florida. And that's basically it. That's where you can find me.
Awesome. What's the next conference you're going to?
The next one I am going to the one longevity by New BioH, the long COVID one.
CLS. Yep. CLS. Yep. Longevity conference, clinical longevity summit on long haulers and COVID.
I cannot wait for that one.
Yeah. Awesome. Okay. Well, we'll tag everything in the show notes. Thank you so much for taking the time, and super excited. I think this will be a really great episode for practitioners who are interested in this space.
Yeah. Thank you so much.